I just got back from one of the most cutting-edge medical conferences of the year, the 10th annual Interventional Orthobiologics Foundation in Scottsdale. And let me tell you, the future of regenerative medicine is incredible. These events aren't just about learning new techniques. They're bringing the latest evidence-based solutions straight to you. Whether it's optimizing recovery, preventing surgery, or designing a pain-free lifestyle that fits you, my goal is simple. Stay ahead so you can stay active. So today I'm breaking down what I learned and how I'm using this knowledge to create real solutions for my patients. Let's get into it. The absolute highlight of the entire conference was meeting the father of orthobiologics with respect to knee osteoarthritis. Dr. Philippe Hernigou is a pioneer. He's followed over 10,000 patients for over 40 years. He's an orthopedic surgeon from France, practicing in a public hospital, so he had to jump through all the hoops to prove that this is safe. And guess what? His landmark study, where I've talked about several times, but let's break it down again. His landmark study is when he took 40 patients. They all had advanced osteoarthritis of the knee. So that means that they were eligible to have knee replacements, both of them. So they were their own control. The knees were randomized. So you didn't say, oh, this is my left knee, let's do this to it. It's the best knee, so let's do that to it. They were randomized. One knee got a total knee replacement. The other knee got bone marrow aspirate concentrate into the bone. The upper bone, the femur, the lower bone, the tibia. At the time, he was not doing inside the joint or intra-articular like we do now, but it doesn't matter. It means that they've been followed now for over 40 years, and that the patients who had the knee replacements, everybody, many of them went on to have revisions because the replacement failed. There were infections, there were bad things that happened, and very few patients had to go on in the opposite knee, the one that had the bone marrow in it, to have a knee replacement. The numbers are minuscule. And if you query these patients now, today, the ones that are still alive, they prefer their bone marrow knee. Yes, they had both. They know exactly what it feels like to have a knee replacement and to have a knee that had bone marrow in it. And I think that's exciting because it stood the test of time, and we've been able to take that and extrapolate beyond. He did 2 presentations, and the first one talked about over the 40 years. It talked about how these patients who have had the life-changing therapies have outlasted their peers. They've lived longer than their peers because they've had more mobility. They've been able to get around and can maintain their activities of daily living, like climbing stairs and doing their own grocery shoppings and maintaining independence and not having to go into nursing homes. But they have lasted longer than their peers. Their all-cause mortality or reasons for death have decreased. I love that. Another thing is that he has talked about how he continues to do research in this, and now he's actually come to the United States, which is fantastic. And he's partnered with a great system, a great company that's offering these orthobiologic treatments to many, many patients who are actually covered under insurance under these private corporate health plans. So it's not your Blues and your Uniteds and your Cignas and all that. These are companies that are very interested in keeping their patients out of the operating room, keeping their beneficiaries out of the operating room. And they know what the cost of something like a spinal fusion is, right? They know what it costs to put hardware here and hardware here and the amount of time off of work, and it's important for them. So he's working with that company. I see wonderful things in the future for this. That was absolutely the highlight. I spoke with him, I got a picture with him, and it was absolutely one of the best things ever to get to meet one of my heroes, somebody that has kept me in this. Another really important thing is we talked about the use of energy medicine, whether that be from Shockwave to lasers to things that are non-procedure based, non-surgical based, because we've got a large subset of patients who are in season. Whether that you're a high school athlete and the recruiters are coming to look at you and you've got a rotator cuff tear and you want to stay in front of the recruiters at your swim meet or at your volleyball match or in the football games. So you aren't ready to take some time off with something like platelet-rich plasma. So the energy-based medicines are coming more to a forefront, and there are a lot of consensus things and even a whole new society on things like Shockwave that are putting out the consensus and putting out the guidelines on the number of shocks per and the frequency of the treatments, the interval between the treatments, the number of treatments total for treating things. So in general, we're looking at minimum of 3, somewhere in the 3 to 5 or 3 to 6 range on Shockwave treatments, and there are different kinds of Shockwave. I'll do a separate thing specifically on that. Other things are the role of nutrition, and this is near and dear to my heart. I've given recent talks on procedure optimization, or what it takes to get you ready to accept these now healthy cells so that we can improve the outcomes, get you better faster, get you back on that court or field or back to your life faster. And so it's super exciting to know that other people are also thinking this way and that we're trying to develop protocols for that. I've got a very specific protocol that I have used and in fact have been invited, like I said, to speak on it. And I hope that more people invite that. And that's everything from getting the labs, optimizing the labs to know that we've got the right vitamin levels, the right lipid levels, the right sugar levels, the right liver and kidney function, and overall platelet levels, because that's important. Everything within the platelets are the growth factors and the anti-inflammatory markers. So optimizing that's fantastic. Optimizing muscle is imperative. And a lot of other people are talking about a prehab protocol like I do. And again, that's super exciting. So those are probably number 1 and number 2 things that came out of it. The third one was just reinforcement of the spine. You know, this is a passion of mine with the spine and treating the spinal unit, not just saying, hey, I've got a disc bulge at L4-5. Let's put some steroid right at that L4-5 level. No, it's saying that the disc is next to the nerve roots and the spinous processes, and the facet joints are affected, and the sacroiliac joints on this side are also affected, and certainly the overlying ligaments, the overlying muscles, everything needs to be treated. So to hear people talk about the functional spine unit and reinforce that that's what we do here at Precision Regenerative Medicine was fantastic. And I believe that we're going to get better outcomes when other people start treating the functional spinal unit as we have been doing. So it's just wonderful to have all the reinforcement. I'll give those top three. Top 3 are meeting Dr. Hernigou, talking about pre-procedure and post-procedure optimization for protocols. And the third is treating the spine. You can extrapolate to the knee as a organ, as an entire unit, and not just treating that one little thing like traditional practices do. This is much more encompassing. It's much more at the root cause, and it doesn't mean then that you're coming back for this and 2 weeks later you come back for that and 2 weeks later you come back for that, and then we get authorization and they say, okay, now you can burn the nerves. Again, regenerative medicine is about constructive or building. It's not about destruction like corticosteroids, like radiofrequency ablation, like putting hardware is. This is about keeping you in the game, keeping you active, and I'm staying ahead. Can't wait to bring you more.
If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.